Consideration, 7.4, consideration of agreement between County of Lake and Kno'Qoti Nation Native Wellness Incorporated in the amount of $1 million for fiscal years 25 through 30. Director Elise Jones.
Good afternoon. Thank you, Mr. Chair, Board. I'd like to begin with this item by providing a brief background on the opioid settlement funds. The Lake County Behavioral Health Services Department was identified as the administrative entity for these funds. And in response to that, we initiated a robust community planning process, which led to the generation of an expenditure plan identifying areas that align with community priorities, which fall into the high impact abatement areas for the opioid settlement funds. That process took about a year. And after that, we issued a request for proposals for the highest priority services that were identified by the community. We received 7 proposals from that RFP. This contract represents the first of 4 agreements that we're currently negotiating that's ready for execution. We chose to bring forward one by one rather than wait for all of them at the same time, not to delay services further. At this point, we have about $7.3 million in reserves from the opioid settlement fund that we've been holding on to. And right now, if with this contract for $1 million, in addition to the other 3 contracts, and then there is also a proposal that is still needing to be fully reviewed by the panel. We are only about 63% committed out of those funds. So there's still a significant portion of funding remaining. And of course, actually, I just received notice today of additional opioid settlement funds. They continue to roll in perpetuity. We will be coming back here shortly to provide a more global overview of the opioid settlement funds, the process. It's our goal to reevaluate this at least on an annual basis with the SafeRx Coalition and to determine the needs of the community and issuance of further requests for proposals. And so with that, I'm pleased to present the first contract that's coming from this settlement, which is delightfully a really high priority area serving Indigenous peoples with a wonderful organization. I've gotten to know Kyle, Bill, and Alvina at Kno'Qoti, and I'm very impressed with their work. And obviously, so was the panel impressed with their proposal. And I'm excited to present this and move forward with rolling out these services to our community.
Thank you. Any questions? Supervisor Sabatier?
So I appreciate the presentation, especially the intro, and at this moment in time, I've been requesting, and I'm glad to hear that it will be happening. We have about $18 million, give or take, that should be coming in, I believe, over the course of anywhere between 15 to 18 years. As was stated, it's trickling in little by little. And in my mind, we have $18 million of possible legacy change. But if we piecemeal one piece at a time, I'm not grasping the vision of how we're going to make legacy change within Lake County without looking at the full total $18 million and how that will be estimated to be utilized. I think this program is definitely a positive program and a good program, but once the $1 million are up, then that program does not show sustainability that it can continue. There might be other dollars available. Maybe we use another $1 million to keep it going, but without knowing what the full vision is of how we're planning to spend the $18 million, we did get what was called an expenditure plan, but there was no dollar signs attached to the long list of community supported services or programs. And I'm just, when we did ARPA, we got $12 million. We sat down, we got estimates for cost of each of the services or programs or projects we wanted to get accomplished, brought that to the board for approval to go ahead and move forward. We have not received that, and I would like to make sure that I understand the vision and the complete expenditure plan before spending more money without understanding how it's going to leave us once the $18 million is over. So at this moment in time, I will be abstaining, not voting no, because the service is good. Kno'Qoti is a well-reputed agency that provides good service. We've worked with them before, back over in COVID times and after. So this is not anything against the contract or the agency. I do not feel prepared to say yes when it cuts into so much of the entire vision.
Thank you for those comments. I would like to point out to the board that our planning process has been recognized as a model planning process in California. I'm not aware of any other county that has actually taken as robust of an approach to planning for these dollars as has Lake County, so I think that that should be a feather in our cap, proverbially. And the expenditure plan is notably open-ended because we have to be able to pivot as a department to meet needs. Additionally, the issuance of the RFP, we are unaware of community capacity until we issue a request for those services. So it's leaving it open to the providers locally or regionally who can step up to do this work. So it's a combination of balancing what our expert assessment of the needs as well as the expenditure plan against what the community's capacity is to lift up those needs. I would also like to highlight that we are using $600,000, we've talked about this for years, towards the county's beach hip project, which is to expand the South Shore Clear Lake Clinic. That project is progressing, and we actually anticipate being able to start those processes hopefully late fall, early winter. So that's a huge investment in expansion in county infrastructure, as well as another planned beach hip award grant, which again, as I demonstrated before, leverages significant and one-time generational state funding to lift up a residential treatment facility in Lake County, a mental health residential treatment facility that's also a duly certified ASAM level 3.7 detox facility, which is unique in the state of California. That doesn't presently exist. So we are breaking ground on that as well, we hope in the near future. Hopefully that's one of the next contracts here that I'm able to bring forward to you. So the department has been very mindful about strategizing to use this funding to leverage those, again, once in a generation funds for long-term investments.
Go ahead.
How much of this goes into prevention? The funding, is there any?
Are you speaking about the specific contract?
Yeah, is there any prevention associated with it?
Yes.
Yeah, okay.
Yeah, for tribal youth to prevent opioid deaths, because our tribal communities, especially youth, have, I don't know how many we've had die in our county.
There's just one recently.
There's been at least, at least a handful, if not probably many more tribal youth that have died.
Okay. And it's for prevention of them getting on the opioids to begin with?
Yes.
So
So pro-social activities to divert youth and give them healthy opportunities for socialization, again, with the goal of preventing opioid misuse and death.
Okay, perfect. Thank you.
Yeah, there has been quite a few in the last year.
In recent, I don't remember, was it last year that we convened a joint press release with many different entities because of a rash of deaths of youth, and many of those youth were tribal.
Right. And from what I understand, I know that that in talking with you before, there's been a real working with the tribes is one thing, but there's also a level of tribal community that even the tribal government can't get in touch with, and so that's why this group, Kno'Qoti, is ideal to work with. And I say that because even in other things that the local 7 tribes deal with, they're like a middle point for that for some reason. Because they're not based out of one specific tribe, they're able to kind of get into areas that federally recognized tribes can't. It's an interesting thing, but it's a good thing. So, yeah. I didn't know if you had something like.
No, I guess the only other comment, I also, in addition to the positives that you noted about this organization, they're local too. And so they already have an extreme amount of connections with the people in a lot of our partner agencies as well. So I think that's a positive also.
Thank you.
Any other comments before I open it up to public? If there's any public comment on this item? All right, I'll bring it back to the board for action.
Mr. Chair, I'll move to approve the agreement between County of Lake and Kno'Qoti Nation Native Wellness Incorporated in the amount of $1 million for fiscal years 2025 through 2030, and authorize the board chair to sign.
I'll second that.
I have a motion and a second. All in favor?
Aye.
Any opposed? Any abstentions?
Aye. I abstain.
One abstention, and motion carries 3-0-1. Thank you on that one. 5. Yes, so we got 7.5, consideration of agreement between the County of Lake and Crestwood Behavioral Health Incorporated for adult residential support services and specialty mental health services for fiscal year 2025 and 26 in the amount of $1,200,000. Elise.
Thank you, Mr. Chair. Yes, this is, we've had an agreement with Crestwood Behavioral Health for many years due to the fact that we don't have any mental health rehabilitation centers or other sufficient residential treatment facilities, primarily for people on Lantern and Petrus Short Act conservatorship. Those individuals require a lot of help and treatment, and while we're working to build local capacity, they remain qualified through an RFQ process to continue to provide these services. We look far and wide to find beds and placements for these individuals as we compete for those placements with counties regionally and across the state. And so Crestwood has proved to be a good partner, and that's what I have.
Any questions or comments from the board? Any public comment? I'll open it up. No hands in Zoom? All right, I'll bring it back to the board for action.
Mr. Chair, move to move to approve the agreement between County of Lake and Crestwood Behavioral Health, Inc. for adult residential support services and specialty mental health services for fiscal year 25-26 in the amount of $1.2 million.
I'll second that.
I have a motion and a second. All in favor?
Aye.
Any opposed? Motion carries.
I'm sorry, I should have read and authorized the board chair to sign. Did I
Lloyd?
not hear that?
You did not hear that because I probably missed it.
Lloyd?
So that motion can be.
I would like to amend my motion. Is that good enough?
Yeah, because it was still in the.
Okay.
We were in the midst of things.
All right.
Thank you for catching that. And amend my motion to approve the board chair to sign.
And further clarification for a second and then the vote.
All right. Do I have a second?
Yes.
All right, so I have a motion and a second. All in favor?
Aye.
Any opposed? Motion carries 4-0. All right, 7-6. Okay. Consideration of agreement between the County of Lake and Redwood Community Services Incorporated for provision of the Lake County RAP Program, Foster Care Program, and Intensive Services Foster Care Program, ISFC, for specialty mental health services for fiscal year 25-26 in the amount of $1,500,000.
Thank you, Mr. Chair. This is, again, a long-time relationship we've had with Redwood Community Services for services around foster youth. We, in the past 2 years, conducted an request for qualifications for any entity qualified to provide these highly specialized services. And Redwood showed up as being able to continue to meet that. No other entity has responded to that. So Redwood remains the only respondent to provide those services. We have been working with them to expand their presence and even physical footprint in the city of Clear Lake because their offices are primarily located in Lakeport, which Clear Lake has more of the behavioral health population. It's a larger city and has their people. So I believe in, I know Miss Laura Sullivan is here from Redwood, so she could clarify that, but I believe that they have secured a lease, maybe even for a year, and are operating out of that clinic as well, because that was important to us to make sure we had adequate South County representation and services for those vulnerable youth. So that's what this is.
Right. Supervisor Sabatier?
Yeah, Mr. Chair, I had an email conversation with Director Jones, and thank you for getting back to me. There seems to be language within the contract following state law, I believe is what you had mentioned, about providing demographics or providing not detailed information, but giving us a little bit more insight as to who this program is serving, so we have a better understanding as to how this program is done. What I'm hopeful, because there is a reporting factor within, is that we'll see this again next year. We've been seeing it for the last several years, is that from here on out, we can get that report attached so we know the results of what this service is doing as far as some potential outcomes and some demographics to get a better understanding of how this program is reaching our community. But other than that, I'm not looking for any changes, just looking for a consensus that is good information for us to know and better understand the type of contracts that we're approving.
Right. Looks like you have that. Is that something that's possible?
Yes, and I will note that, as you all are aware, that we've entered into a new electronic health record, right? And one of the goals of that, and why we're hoping all the pain was worth it, is that you can better pull outcome and demographic data. So all of our contracted providers have a portal into that and enter their data into our electronic health record. And they're continuing, as we speak, literally to build capability to pull that kind of data, because that's also required through behavioral health transformation. The state of California similarly wants to have more outcome data. So outcome data has been, is not, you're not alone in that, and we hope we want to see that as well.
Right. I'll open it up for the public if there's no other comments.
Good afternoon. Angela Emerald. Just wanted to say, as someone that went through the wraparound program many, many years ago, it's an absolutely wonderful program. And you may not see changes for years down the road, but it does make a huge difference. So thank you, Elise, and thank you for everyone.
Any other public comment?
Good afternoon, Board. My name is Laura Sullivan. I'm the Program Director with Redwood Community Services. Thank you for the opportunity to speak today. Redwood Community Services has proudly partnered with Lake County Behavioral Health since 2002 to provide essential mental health services to children and transitional age youth across the county. Through this partnership, we've delivered early intervention and special mental health services that help young people heal, grow, and reach their full potential. This year, we are especially proud to share, as Elise did, that we opened a second location in Clear Lake. This is allowing us to expand our service delivery and increase access for families in the southern region of the county. This expansion is already making a difference in reducing barriers to care and reaching youth who need support closer to home. We serve some of the most vulnerable members of our community, many who face complex challenges, including trauma, poverty, and generational adversity. With the county's support, we've been able to improve outcomes for youth, strengthen families, and contribute to the overall well-being of Lake County. We value this partnership and remain committed to delivering high-quality, compassionate, and culturally responsive services. We look forward to continuing this vital work together to ensure that every child and young person in Lake County has access to the mental health care that they so deserve. We'd have no problem helping get any data that is needed just to add that in, and we look forward to your continued trust and support. Thank you.
Thank you. Any other comments? All right, I'll bring it back to the board for action.
Mr. Chair, I'll move to approve agreement between County of Lake and Redwood Community Services Incorporated for the Lake County RAP Foster Care and Intensive Services Foster Care ISFC programs for specialty mental health services for fiscal year 25-26 in the amount of $1,500,000 and authorize the board chair to sign.
I second that.
I have a motion and a second. All in favor?
Aye.
Any opposed? And that motion carries. Thank you.
Thank you.
All right.